Good morning, everyone, and welcome to today's Fundamentals of the Individual Under 65 Market webinar. My name is Chelsea Smith. I am the one of two learning and development specialists here at Action Benefits. And today we are going to be going over, as you might have guessed by the title, the fundamentals and basics of working within the parameters of the individual under 65 market. So let's go ahead and get started. So by the end of our session today, we should be able to do these 5 things. We should be able to describe the role of a health insurance exchange in locating individual coverage in Michigan. We should be able to identify the metal tiers that describe plans in the individual market. We should be able to identify additional factors that may impact consumers' out-of-pocket costs. We should be able to identify situations in which consumers may participate in special enrollment periods, and describe pathways to getting certified or recertified if you're a seasoned agent in the federally facilitated marketplace. So lots to go here. So let's get on with the show. No further ado. So before we get into any of the normal parameters of our show, I'd like to talk briefly about the consent forms that are kind of new for 2024, but started back in 2023, right? So if you're someone who works in the Medicare space as well as the individual space, you are already familiar with these forms, but you might be and should be using the phrase scope of appointment to refer to them because that's what they are in the Medicare world. But as of June 2023, like I mentioned earlier, the marketplace is going to require you to submit a consent form prior to accessing or updating any marketplace information. So CMS hasn't regulated like specifically which one you're going to want to use or how or what type of form you're going to use. You can use whatever form you like so long as they do meet the criteria that we'll talk about momentarily. That version, we have created one for you that we think will be best, and it also covers everything that you need to be compliant. That version is available in C4-1, and you now have the pleasure of viewing it on your screen now. So we highly recommend that one, not to toot our own horn too much, but that is a great option for you if you're looking for a form that you know will meet all your needs without having to go on and create one yourself. So at minimum, the document must contain the following information: a description of the scope, purpose, and duration of the consent provided by the consumer, the date the consent was given, the name of the consumer, the name of the agent, broker, or agency, and the process through which the consumer or their authorized representative may rescind the consent. So as long as you have all those things on your document, it is rip-roaring ready to go, as long as you have all that information, but you also can just use the one that we created for you. We also created for you a review of marketplace eligibility applications. This form reminds your clients that all information submitted must be true and that information must be updated if it ever becomes untrue. So all of those forms are available in C4-1 that we've created for you that will meet the parameters necessary to remain compliant. Since CMS has not granted more specific information, you can customize those forms however you wish, so long as that information that I just said is on there. We can also brand them for you. So if you are someone who plans on using these worksheets often with your clients and would like something a little more personal to your business, we are totally able to make those for you. Just give us a call, give us or shoot us an email our way, learning@actionbenefits.com. Randy and myself will jump to the call. If you don't want to use a form, if you're not a form kind of gal, then you can use email, text, or record a phone call. Those are all also valid options. Those documents must be stored for 10 years, just like scopes of appointment. This is kind of why I err on the side of saying that a digital version is a great idea, because if you get into the habit like I did in previous jobs of saving everything on your laptop to an external hard drive or your desktop, whatever you so choose to use, onto an external hard drive and keep that safe somewhere and just don't throw that thing away for 10 years, then you are well on your way to having an easy time with staying compliant, right? Very easy to do that instead of having to worry about oh my God, where did I put that paper? Or where did it go? Where did I file it? Digital, I think, is the way to go here. If you have more questions about the practice of consent, because you are new to it, if you are someone who is exclusively under 65, then you would probably like to visit our course on mastering marketplace consent, which is also available here. New big requirement. So we have about a 45-minute course designed to help you make sure that you are hitting everything that you need to hit. So let's hop into health insurance exchanges. So we're going to begin by offering a crash course on insurance exchanges and various types of exchanges that might be used across states. We offer this not only for historical context, but also for the benefit of agents that might be in border areas and working over state lines. Understanding the type of exchange a state uses can help us make a sense of why doing business in Michigan might be a little different than if you did business in, say, Ohio or Wisconsin. So let's start simple by defining what we mean when we say a health insurance exchange. So healthcare.gov defines it as a service available in every state that helps individuals, families, and small businesses shop for and enroll in affordable medical coverage. So this sounds like a lot to store, if this sounds a lot like a store or a marketplace, you're totally right. The exchange operates by the federal government, is formally known as the health insurance marketplace. So you might hear the term marketplace thrown around. I do it all the time. States, through their own legislative action, decide how its exchange will operate inside its borders. There are 4 broad models to use across the nation. So first we have state-based or state-run marketplaces whose enrollment websites and plan administration is conducted entirely by the state. State-based marketplace FPs, these are usually state-based marketplaces that use the federal enrollment platform to conduct enrollments, including the administrative functions behind the scenes to ensure coverage. State-federal partnership exchanges, some states like Michigan and Ohio, us, use the FFM to conduct all enrollment and eligibility verifications. However, the state takes on the role of certifying qualified health plans in these states. So while we in Michigan use the marketplace that the state provides for us, we certify our own plans and make sure that they meet our criteria of what we want in our state. We don't leave that up to the feds. In a federally facilitated marketplace state, in these states, the marketplace is entirely reliant on healthcare.gov. Everything is done by the feds, and all plan management functions, nothing is done at the state level. Wisconsin runs like this. So that's kind of a background on how different states choose to function within the health insurance realm for individuals. So in a practical sense, what does this mean for doing business in these 3 separate states, Michigan, Ohio, and Wisconsin? Since all 3 of these states use a federally facilitated marketplace, they must adhere to some timelines established by CMS. So in general, in April through mid-September, plans and carriers go through a long approval process with a lot of back and forth between themselves and CMS to ensure that the plans meet all the federal requirements. I made this sound super like easy and glossy and like, oh, it's no thing, but it really is a lot of work, and it is a crazy process to ensure that all plans are getting what they need and giving what they need to their clients as well. But since we aren't doing it ourselves personally, I can just say that that's what happens, and we can just leave it there. You might be interested to know that plans and carriers are obligated to have their marketing URLs active by late September of each year. This means that in the absence of other communications, we can regularly check on these websites for updated communications. But by mid-October, and shortly before the beginning of open enrollment, CMS will release its quality ratings for qualified health plans. These ratings are meant to guide consumers in selecting plans that are most appropriate to them and can be helpful in steering conversations as you consult with them. And then last but not least, finally, the open enrollment period, as we all know, begins on November 1st and ends December 15th. And during this period, eligible individuals can sign up for health plans for the first time or change plans as appropriate. We'll touch more on OEP later in today's session. We share this information to shed some light on how the sausage is made. Oftentimes we don't get to know every crumb of information and the what and the whys, but these are key dates that are formalized each year and can help you serve as tent poles for your understanding of what to expect through the entire year. So that gets us to our first knowledge check. In Michigan, we operate as a state-federal partnership exchange. We talked about that earlier. Practically, what does that mean? So B is true here. There are many federal guidelines that dictate what can and can't be done, and those things impact the overall flow of the year, right? So we, in our state, assume the plan management functions. We certify plans. We make sure that they work for us in our state, but we let the feds take care of the marketplace and making sure the marketplace functions properly. Awesome. So let's head into metal tiers really quick. And this is where some clients can get a little confused. I know that when I was before I started working in healthcare, I learned a lot about metal tiers because I thought that they meant something totally different than what they mean, actually. So I functioned before I worked in health insurance under the misconception that metal tiers indicate how good your health insurance is. Like the people who have platinum health insurance have like the best health insurance, and those of us with catastrophic insurance have the worst. And that's not necessarily true, right? As some of us might already know in the audience today, metal tiers arrived with the inception of the Affordable Care Act, and they're not meant to indicate how good the coverage is. They're instead meant to indicate how the cost sharing within the plan is structured. So if someone has a such and such plan bronze, that person has the same coverage that a such and such platinum person has. They just share the cost of how they pay for that care differently. As a precursor to our deep dive into metal tiers, before we start talking about each tier on an individual level, we want to reiterate that metal tiers are not indicators of the quality of care that patients are going to expect. In fact, all qualifying health plans offered on the marketplace today must have a set of 10 essential health benefits, regardless of their metal tier. I always think of them as the 10 commandments of individual healthcare. So these 10 are on your screen right now. They are ambulatory patient services, emergency services like hospitalization, pregnancy, maternity, and newborn care, both before and after the birth of the baby, mental health and substance use disorder services, including behavioral health treatment, things like counseling and psychotherapy, prescription drugs, rehabilitative and habilitative services and devices that are used for injuries and chronic conditions, laboratory services, preventative and wellness services, pediatric services, including oral and vision care, but that doesn't also then travel into adult dental and vision. Those are separate things that are not essential health benefits. So individuals and families can expect these services to be covered by their insurance, regardless of their metal tier, regardless of their carrier, regardless of any of that. Those 10 things will always have to be covered in some way, shape, or form in your health insurance if you are going to be using the marketplace to purchase your coverage. So your platinum tier, if we're starting at the highest and going lower, your platinum tier pays about 90% of the cost of your plan when you go to utilize your benefits. It has the highest monthly premium though to balance that out. So you're going to be paying the most month to month, but you will be paying the least when you walk into your doctor's office or specialty, wherever you're going to get some care, right? So highest monthly premium, but lowest cost when getting care. Deductibles are very, very low. The plan pays its share very early for other categories of plans as well. And this is a good choice for people who know right off the get that they're going to be using their care often and are totally fine with paying a high monthly premium off the bat because they know either way they're going to be going to the doctor or going to be using their health insurance often. So they don't really care if they're going to be paying a lot every month because they know it's going to work out for them. Gold tier is very similar to platinum, just 80% instead of 90%. It does still have a very high monthly premium, not necessarily as high as the platinum, but still fairly high. The costs are still pretty low when you go into the doctor, and your deductibles are usually pretty low. This type of tier is a good choice for those who use benefits often, but aren't in and out of the doctor every day or something like that, and are willing to pay a little more each month for their coverage. Then we have our silver tier. This one pays about 70% of costs. Again, as you might have guessed, The monthly premium is a little lower than gold and platinum, but still more expensive than your catastrophic or your bronze. There are some costs when getting care, but again, not as high as maybe your bronze or your catastrophic. The deductibles are usually a bit lower than bronze plans, but they're starting to get a little up there. This tier is particularly important to us as agents because this tier is where you will qualify for cost sharing reductions if you are someone who qualifies for those things, and you must pick a silver plan in order to get those cost sharing reductions applied if you qualify for them. You cannot get a bronze plan and get those same cost sharing reductions. This plan is a good choice for you if you're willing to pay a slightly higher premium than the bronze and catastrophic to have more routine care covered. So if you're someone who goes to the doctor sometimes, not a ton, but you go sometimes, and you don't want to be paying huge premiums, a silver plan is probably your best bet. A lot of people fall within the silver range, but there also are some people who choose the bronze tier. Because the bronze tier pays about 60% of the costs of your exploration of care when you go to get care. But in exchange, it does have the lowest monthly premium of all the tiers. Not counting catastrophic, but we'll get there in a second. Catastrophic's a little different. But in exchange, you are going to pay the highest amount when you go to get that care. Deductibles are generally thousands of dollars per year. I've seen some as high as like $8,000–9,000. It is a good choice if you're someone who probably isn't going to use your benefits, or if you only want some support in the worst case scenarios. Sometimes it works out where it is a little cheaper to be on a bronze plan, especially if you're someone who doesn't go to the doctor a lot. But if you're going to go to the doctor a couple of times, maybe that silver plan is better for you. Then finally, we have our catastrophic plans. Those don't have a set actuarial dollar amount. And they are very limited in those who are eligible for them. So generally only people under 30 are going to be eligible to get a catastrophic plan. People with hardships or affordability exemptions still might be able to get their hands on one. They have incredibly low premiums and are not eligible for any premium tax credits, but those deductibles are incredibly high. They're very, very high. I had a catastrophic plan myself when I first turned 26, when I was booted off my parents' coverage when I was a substitute teacher. And let me tell you, though, it covered like nothing. Like, it was very, very basic. Premium was very low, but it was very, very basic coverage. That brings us to our next knowledge check. So Joseph, 28, is eligible for cost sharing reductions based on his income relative to the federal poverty level. Which metal tier might be most appropriate for him? As some of us seasoned agents will know, the correct answer here is B. B is the only level of coverage, or metal tier, I should say, the only metal tier where extra help and cost sharing is available. You cannot apply those to other metal tiers. So if he is interested in taking advantage of that cost sharing reduction, he is going to have to pick out one of those silver plans. Okay, so let's move into rating factors. So how is a premium determined for someone who is looking to get coverage? After you've picked out your metal tier, now it's going to determine how we know how much they will pay for that coverage. So there are 4 factors that one can use to rate his or her premium. Premiums can be up to 3 times higher for older people than for younger ones. They're applied at the member level, and members have until age 21 to have a single age band, or approximately 60% of the rate of the age of a 21-year-old. So essentially, the older you are, the higher the premium might be. Next is your location. Each state establishes rating regions. Michigan has elected 16 rating regions. The primary residence's address will determine the rating for that region. Tobacco use. The ACA permits users to charge up to 50% more for using tobacco than those people who do not. Family size is another one. Rates are applied at the member level, so rates will vary whether a plan is meant to cover one person or several. There's a dependent cap in place as well. Plans can charge for no more than 3 children under the age of 21. So what that means is if a family of 6 has 4 children that are all under the age of 21, the family is going to be rated as a family of 5, with the youngest child being excluded. For the 5 billable members, the age rating factors would be applied at the member level. So, another knowledge check. In the last year, the Jones family has welcomed a newborn and moved from Owasso to Royal Oak. When the Jones family seeks to change coverage during the open enrollment period, Mrs. Jones is surprised by the change in her premium. What could be the likely causes of this change? So there are 2 things that would have changed the premium for the Jones family. The increase in family size, having that new baby. And the second one would be relocating to a higher cost of living area. As we know, Royal Oak is a little more expensive to live in than Owasso. Different region means different costs. Okay, so let's move into the premium tax credits and cost sharing reductions for plans sold on the individual health insurance marketplace. We briefly talked about these earlier, but let's get a little more into the details of some of these ways that you can get your clients some discounts on their premiums. So under the ACA, premium tax credits are available to consumers based upon their income estimate and other household information provided when they choose to enroll. So right now, it's important to know that consumers may qualify for credits on a sliding scale. That means that consumers closer to 138% of the federal poverty levels are eligible for more credit than consumers who are at 400% of the federal poverty level. So during 2024's special enrollment period, incomes that are above 400% of the federal poverty level may also qualify for a credit. So if we think back to the Jones family really quick, that family of 3, under the ACA, they would be eligible for a premium tax credit unless their household income reaches $99,440. But the Inflation Reduction Act changes this calculation a little bit. So for reference, the 2024 federal poverty levels and 400% of them are displayed on the screen in front of you, which means that a household of 4 could have a combined income of $120,000, but still qualify for a premium tax credit. So they might make a good portion over that federal poverty level that would stick in your mind, just that being a person that would qualify for some subsidies. You can be quite far above that and still qualify for some sort of subsidy on the marketplace. For 2024, enrollees on the health insurance marketplace will pay no more than 8.5% of their household income in premiums. This is a significant change that was brought on by the Inflation Reduction Act last year. All, some, or none of the premium tax credit may be issued in advance. Consumers get to decide how they get that tax credit when they enroll. It should also be noted that these credits are only available for plans bought on the health insurance marketplace. So if you're someone like myself here at Action, and we have our own group coverage, you would not qualify for these tax benefits, and it is not something that you can look forward to getting in your tax returns. But no, get your health insurance covered, hopefully in some ways by your employer. So the American Rescue Plan, Inflation Reduction Act, and subsidy eligibility all have the in common factor that they did create more of the extensions of these tax credits. So the American Rescue Plan temporarily expanded the availability of these credits to eliminate the subsidy cliff that was in place previously. From 2021 to 23, enrollees in the health insurance marketplace paid no more than 8.5% of their income in premiums. And that will continue on through 2024. The Inflation Reduction Act renewed these subsidies in place of the American Rescue Plan Act from 2023 to 2025. So the Kaiser Family Foundation estimates that 92% of current people on the marketplace are now eligible for marketplace subsidies. So that's a ton. That's like almost all of the people who are going to be using the marketplace to get their coverage qualify for some sort of tax credit or subsidy from the government. So that might be a great marketing point for you as the agent to help your clients make a purchase of a plan that is right for them, or to get them to sign in for some health coverage. So premium tax credits may be used on any metal tier plan. This is different than cost sharing reductions, right? So using more of the credit than final yearly income is qualified means you need to replace that money needs to be repaid back, and using less would qualify you for a refund. Premium tax credits are different than cost sharing reduction. Some members qualify for extra savings in the health insurance marketplace, such as CSRs. Under the Affordable Care Act, members must enroll in a silver plan to access CSRs. CSRs provide lower deductibles and lower out-of-pocket maxes, but members of federally recognized tribes or Alaska Native Claims Settlement Act corporation shareholders may qualify for additional CSRs. So if they're qualifying for that, that'd be great to let them know. So for an example, just for ease of use here, we're going to use the Blues plans here. So the Blues offer different flavors of their silver plans to reflect these cost sharing reductions. And we can point out some things that are helpful for us to remember as we help educate those consumers. First, we'll notice that a new variable is added to the plan naming convention, either 70, 73, 87, or 94. And that reflects the total estimated actuarial value of the plan, the percentage of the healthcare costs that this plan is meant to cover. Next, we'll point out that a member's eligibility for that particular flavor of the plan, 70, 73, 87, 94, is tied to their income estimates as it relates to the federal poverty levels. We'll notice that the actuarial value increases within a plan from 70 to 94, and deductibles and out-of-pocket maximums decrease. Plans that cover 94% of costs will also see a decrease in their copays and PCP visits and urgent care. The same things are true about cost sharing reductions available through Blue Care Network's HMO plans. 4 different tiers. Eligibility for each tier is determined based on income. Same thing, out-of-pocket maxes, PCP visits, all change and decrease as the actuarial value of the plan increases. So this table that you're seeing on your screen here is provided as a reference. It captures the federal poverty levels for the households' incomes of varying sizes in 2024, and the thresholds at which these households might be eligible for varying levels of cost sharing reductions. Think about how that members within a household income greater than 250% of the federal poverty level don't qualify for any cost sharing reductions, but they might qualify for some premium tax credits. Remember, 2 different things, 2 different applications, 2 different ways to qualify. So the key points of all of what we just talked about is that income changes throughout the year can impact premium tax credits and cost sharing reductions. The American Rescue Plan allows for a special enrollment period for individuals and families whose eligibility for cost sharing reductions is altered due to a change in their income or family size. So let's move on to enrolling in individual and family coverage. There are 2 types of enrollment periods. One is the open enrollment period, and that goes from November 1st through December 15th, like we mentioned earlier. Individuals and families alike during this time can enroll for the first time in health insurance coverage. They can change their coverage, or they can change the carrier of that coverage. All fair game. Special enrollment periods are a little different. They start when a qualifying life event occurs to that person. Generally, that window extends 60 days before and 60 days after that qualifying life event. But they can change a little bit depending on what that qualifying event actually was. So for example, there are 4 different types of qualifying life events: a change in household in the past 60 days, a loss of health coverage in the past 60 days, a change in residence in the past 60 days, and some other events, maybe like a natural disaster. Hopefully it's not that one. Hopefully you have a marriage and you're very happy, or you had a baby and you're very happy, and those are the reasons why you have a qualifying life event. We also have ICRAs and QSARAs in the individual marketplace, and these are health reimbursement accounts. If those of you who have ever had group coverage or have worked in group coverage are familiar with these maybe as HRAs or HSAs or FSAs, but we also have these ICHRAs and QSARAs. And they allow employers to assist with the cost of coverage. These forms of assistance can affect premium tax credits and cost sharing reductions though. And they do create an SEP, the introduction of the offering of these types of savings accounts. But this type of SEP requires a call to the marketplace. It's a little more involved than a standard SEP. And so these type of enrollments can't be accomplished online. The client might still want you to assist with them in enrolling for coverage, but you would have to call the marketplace to help you help them because that's not an option generally on the marketplace. I'm not going to go into a lot about what ICHRAs and QSARAs do. We do have another course on those if you are interested called FSAs, oh my gosh, I'm so sorry. FSAs, HSAs, HRAs, oh my is the name of the course. So if you are interested in learning more about those, check out that course. So enrollment pathways, there are 2 different pathways that you can use to enroll someone. You can use a direct enrollment pathway such as triedandtruehealthcare.gov. You know it, you love it. You can use that if you want. Or you can use an enhanced direct enrollment website. So members would enroll via a third-party website such as our personal favorite, but we're a little biased, Coverage for One, Health Sherpa, Get Insured, Stride Health, bcbsm.com. All of those are also options for you to help enroll your clients. That brings us to another knowledge check. So let's go back to the Jones family right quick. Their newborn came along in January. Congratulations, Jones family. How might they have added the newborn to their health insurance plan? There is one correct answer here, and that answer is C. The Jones family would be able to add their newborn within 60 days of the birth of the baby because of the special enrollment period created by the change in household, having a baby, getting married, change of household. You can then just add the baby onto your coverage. I mean, they could wait till the open enrollment period, but why? Just throw the baby on when you have that special enrollment period. So we've talked about what to do. We've talked about what goes on in the marketplace. I know you're eager to get onto the marketplace and start selling. So how can you get yourself certified and onto the marketplace to get selling? But before we talk about the process itself, we want to share a few facts that might make a certification a more intriguing option. So first, it's important to note that a federally facilitated marketplace certification is a prerequisite to earning commission for on-marketplace sales. AKA, you have to be certified in the marketplace to make commissions off of the marketplace. So you can go on there and sell, but you're not going to make anything. So you might as well get certified. It's important to keep in mind because of the Inflation Reduction Act that the expanded eligibility for premium tax credits are going to create more consumers that are eligible for subsidies on the marketplace. So you're going to have more consumers, and with that unwinding as well, don't forget about that, you're going to have way more consumers than ever before willing and able and wanting to sign up for coverage on the marketplace. I just went to a CMS webinar yesterday to talk about the unwinding, and they were saying that more people are enrolling, especially new to the marketplace, than have ever before in the history of the marketplace. So if there was a time to get certified and start your under 65 journey on the marketplace, now is it. Now is totally it. And we can help you with that. We also have heard some conversation in the field about how the income levels are changing for eligible subsidies. Through 2025, the subsidy cliff has been eliminated, so there's no hard stop for someone who would make over the poverty level getting booted off of those subsidies. As we talked about before, you can earn as much as 400% of the federal poverty level and still get some sort of subsidy towards your marketplace coverage. Nobody should be paying more than 8.5% of their income for health insurance if they're on the marketplace. And what do all those things mean for you? It means that, like you said, 92% of the current individual purchasers are now eligible for those subsidies. So many people are going to be eligible to get cheaper health insurance than they either once did or are presumed to think that they could get. great time to hop on the marketplace and start trying to sell. And with all of that being said, we are happy to contract you in a referral program to support you in this specific market too. Again, I feel like I broke a broken record. There's no better time, in my opinion, to sign up for the marketplace and start selling there than now. Hopefully I've sold it to you, and we can outline what the certification process for doing that would look like for you once you get started. So being certified in the marketplace is mandated by CMS for assisting consumers with on-marketplace enrollments, whether those enrollments occur being a direct enrollment process like healthcare.gov or enhanced direct enrollment like Coverage for One. Either way, you still have to be certified. For 2024, certification trainings are offered through the CMS portal, the Marketplace Learning Management System, and then Health Sherpa also has one if you're interested in taking it through them. The first portion of that journey, I like to have it all just on the screen. The first portion of the journey takes about 10 minutes. Step 5, the actual training portion of it, can be completed in an afternoon. I completed the training in about like 3.5, 4-ish hours. I was answering emails in between, I'm not gonna lie, so it might have taken me a little longer because I'm sure you're gonna do the same thing. Let's be real, right? So those last few steps at the bottom there are relatively short, and in total, it will not take you longer than a half hour to do those things. Recertification follows much of the same process, though without the account setup steps mentioned previously. So instead, the Marketplace Learning Management System will ask you to verify and update your information, change your password, probably, and then point you toward training sessions. These training sessions for you as someone who is re-upping is a slimmed down training for returning agents, but it's probably helpful to block out the afternoon anyway, just in case. And then you just have extra time for yourself instead of pushing yourself in rushing through it and not getting it finished to the full capacity. So that brings us to the end of our course today. Thank you for spending time with me to learn about your options within the marketplace. And hopefully I've convinced you today to get certified and start selling in the individual space. It now is a great time with the increase in subsidies and the unwinding occurring. We're putting more bait in the water there to get you the best selling experience that you can. So happy enrollments, get out there and sell, and thank you for spending time with me. Have a great rest of your day. Bye.